All right, we're going to be talking about our final section for Chapter 10 of muscle tissue with length-tension relationship. That said, we're talking about how the tension in a muscle develops dependent upon the length at the time of stimulation. Fiber to resting length generates maximum contractile force. About that point, you're basically, because of the stability at the joint, there's optimal overlap of thick and thin filaments. It doesn't mean that necessarily you are at your physically strongest, but certainly near the end range, because of course we don't, really it's designed that way so you don't hurt yourself, so you're strong at that point. From the standpoint of you being able to produce maximal tension during the range of motion, it's actually more like mid-range, a given motion in a single joint. Okay, so we don't talk about the standpoint of how much it can withstand from a tension. That we're talking about from something being pulling on that muscle. And the joint structure itself, the way the joints are designed, we don't confuse the two here. When you're moving through a single joint through a full range, mid-range where you're strongest. Don't confuse that with the muscle itself independent of anything else, which is what we're talking about here. The fiber at shortened length generates weaker force. The shorter the muscle, the less force capacity there is. Filament movement is limited. You're already close to the Z disc. And fiber at extended length generates weaker force as well. So when you're actually in active mode, actually lengthening the muscle, as you get forward closer and closer to the end range, you're going to be weaker again with minimal thick and thin filament. It's the optimal cross about mid-range where you get the most force generation during activity. So with this length tension curve here, showing this contraction, we get partial contraction, and resting length is true. At full resting length, that's true. But you're basically, when you're near about mid-range contraction there, you're going to have your maximal force capacity when you're lifting a load. And of course, when fully lengthening, you start decreasing in capacity as well. Muscle fatigues, in terms of muscle fatigue, is when there's reduced ability to produce muscle tension. It's primarily caused by decreasing glycogen stores during prolonged exercise, but it's really broader than that. We're talking about the development of excess hydrogen ions from previous work being done is really what it is. It's not really so much you're lacking glycogen that's playing a role. Yes, certainly playing a role with it, as well as the development of excess hydrogen ions playing a role there, and occupying those hydrogen ions occupy sites where myosin heads would be trying to bind, or actually more specifically, there are certain other components that are trying to bind and cannot bind or inhibited because of the binding being occupied by these excess hydrogen ions. And like we mentioned before in a previous chapter, these excess hydrogen ions that are created in general are always looking for something else to attach to these free radicals, and they often get in the way of a lot of activity in the body, and that's what really helps induce that fatigue, whereby you cannot produce enough ATP to match up with the fact that at the same time you're developing a lot of excess hydrogen ions. What you don't ever want to say it's because of lactic acid development. That is not what the cause of fatigue is. Other possible causes are excitation of the neuromuscular junction where there's insufficient calcium to enter the synaptic knob. That plays a role. There's decreased number of synaptic vesicles in this case. Excitation, contraction, coupling. There's altered ion concentrations that impair the action potential with conduction and the calcium release from the sarcoplasmic reticulum, more deeper wise. And cross-bridge cycling, excessive inorganic phosphates, as we just mentioned, slows release of the phosphate from the inorganic phosphate of the myosin head, less calcium also available for troponin, and then some calcium is bound to inorganic phosphate, and so consequently you lose capacity to produce more force or keep going, and you start to fatigue as well. If we were really asked with the question point blank, the primary cause of muscle fatigue during activity would really be the combination of excess hydrogen ion development along with incapability of producing ATP at a sufficient level to match the demand. So what's the function of skeletal muscle to tone? You should be able to answer that question. Not to tone, but tone. When you flex your biceps brachii, that's a terrible term. They put the text put that there, and I left it here, but you don't flex your biceps. Flexion is a motion where you're decreasing the angle between two bones. You don't flex your biceps. You concentrically activate it, or you isometrically hold in place, or you eccentrically have an eccentric action as you're lowering a load. But that said, you don't really flex your bicep. So that said, I kind of gave you the answer there. When you're doing a bicep curl, what's the type of movement? So in other words, when you're moving into flexion, what would that be? Describe the relative force of contraction that can be developed in your back muscles when you bend at the knees to lift an object, and when you bend at the waist to lift an object, based on length tension relationship. And of course, should note that if we're bending at the waist, it's actually a hip motion, not a back motion should give you some information there. And of course, when you're lifting from your knee, well, then activity is coming from the knee, so something that has involved more of knee activity is playing a role there. And that said, either way, kind of a trick question there, not intended to be, but it really does come across that way. I don't think it was the intention of the textbook when they put this together, but back muscles will have the same response in both situations. Okay. Now, how can, assuming that the motion isn't coming from the back, which we really don't want it to be. That said, how can muscle fatigue result from changes in each of the three primary events of skeletal muscle contraction? I like how they call it events. That said, effects of exercise and aging on skeletal muscle. Learning objectives here, you must compare and contrast the changes in skeletal muscle that occur as a result of an exercise program or from the lack of exercise, and summarize the effects of aging on skeletal muscle. Well, the changes in muscle from a sustained exercise program. Endurance exercise leads to better ATP production or more mitochondria, greater number of functioning type 1 muscle fibers. And so you're going to basically have capacity to produce more force because of the fact you have more type 1 fibers and consequently higher red blood cell content, higher hemoglobin content, and certainly leading to the capacity to produce force for longer periods at lower intensities, like we mentioned, 2 or 3 minutes and beyond work-wise, potentially to way beyond 15 minutes, 20 minutes and beyond, all depending on where we're talking about development of long-term duration endurance, more specifically near your lactate threshold, which is more like 12 to 15 minutes of activity, which your maximal capacity is in that time frame. Endurance exercise in general is going to be type 1 fiber, aerobic type dominant from a general standpoint. Doesn't mean there isn't some crossover with type 2A fibers and potentially glycolysis or even other energy systems during that activity, depending upon we're talking about the beginning or the end or the middle. The resistance exercise leads to hypertrophy, is what the textbook notes. I'm going to make a clarification. I left it the way it is because I want to keep it consistent with the textbook, but to talk about it. Hypertrophy occurs in any form of exercise where you have adaptation over a period of 6 weeks or more. The first few weeks, about 6 to 12 weeks really, are more related to neural changes, neural effects. So consequently, when someone gets stronger within a month of training, and what they're really talking about is the better recognition of the nervous system and the muscular system, the neuromuscular response, so that the body recognizes what motor units to fire and when, the right timing, the right sequence, and get the right number of fibers involved in order to get the most out of the muscle for greater force production capacity. It's not related to size. Hypertrophy doesn't occur for at least 6 weeks of at least for measuring it accurately. You have to be engaged in a program for at least 6 weeks, maybe as much as 12, to show any difference in hypertrophy. So this is a little misleading, but it's not wrong. It's just a little bit too biased toward one versus the other because there's crossover here. You get some endurance for some resistance training. You get some hypertrophy for some endurance training, just less or so of each. That said, hypertrophy is basically where the muscle itself increases in size due to increases in synthesis of contractile proteins. So the muscle fibers themselves are getting bigger, and muscle also increases glycogen reserves in the mitochondria. It also appears to stimulate a limited amount of hyperplasia. Well, that's questionable. Very, very limited. That's actually a little sketchy, and I left that there as well. Hyperplasia is really highly unlikely to occur in most humans at all. So it may happen to some extent, extremely limited if it happens at all. And it's related to more high-level elite type athletes, and you'd know if that was you. If you're growing new fibers, that's hyperplasia. Growing new fibers out of the ones you already have, that's not likely. It's most likely just hypertrophy. Changes in muscle from lack of exercise, disuse. Basically, atrophy is a decrease in size due to lack of use. You don't use your muscle fibers or muscles, the fibers themselves will atrophy over a period of starting within as little as a week or 2 weeks. You start to lose some size. It happens fast. Unfortunately, you lose it faster than you gain it. However, the exception being that you can gain back a lot of your losses, even if you've been not training, because the loss starts to slow over the course of many, many months. In a 6-month time frame, if someone stopped weight training over 6 months, it's potentially possible with the right training program within 6 to 8 weeks to gain back what you lost over those 6 months. Pretty crazy, really. So when I say you lose it faster than you gain it, well, the short term, that month time frame or 4 to 6 week time frame, 4 week time frame, you'll lose it faster than you gain. But the build up time frame is going to get actually going to be getting just as much that you lost in a 6-week time frame, which you can gain it back what you lost in a few months. Pretty impressive stuff. Unfortunately, endurance does not build that quickly. Endurance is harder to build than it is muscle size, generally speaking. Now, when we say muscle size, as it relates to the muscle fiber capacity that you have, it doesn't mean everybody can get bigger easier than they can have and build endurance. That means the muscle fibers that you are using are more likely to have some hypertrophy to an easier extent than you'd have endurance buildup from a standpoint of long-term endurance. Okay. Someone wearing a cast, atrophy is a reason why you might be having some muscle atrophy. It's initially reversible, but becomes permanent if extreme. Reversibility is the loss of muscle fiber, muscle size, fiber size. Loss of muscle mass with age. Slow loss begins in the person's mid-30s. We talked about osteopenia, bone loss occurring about in the mid-30s. So too does muscle loss also occurs in that same time frame. Sarcopenia, whereby you start to lose muscle fiber size. Okay, that's sarcopenia. About mid-age, typically speaking. However, assuming a person does not lose, and the book doesn't get it, there's only so much the book can talk about. But from a general standpoint, if you don't stop training, you train at a high level, you can reduce your losses by about 50%. What would normally happen if you weren't training at all? Something to keep in mind when not losing the idea of exercise as we age. Decreased size will occur to some extent, though, on power and endurance of skeletal muscle over the course of the 30s and 40s to some extent. And it starts to grow dramatically. They get in the 50s and beyond. Be at 50 pretty quick here. Loss in fiber number as well, and the diameter, loss in the size, and the number of fibers also starts to happen around that age period. Decrease in myofibrils. There's a decreased oxygen storage capacity, and there's decreased circulatory supply to muscles with exercise. In the best case scenario, someone by their mid to late 30s probably could be within a few percentage points of their maximal capacity they had in their 18s and their teens and their early 20s. That's someone at a super high level. A lot of people are going to lose a lot more than a few percentage points from the max capacity. Reduced capacity to recover from injury as well. Decreased number of satellite cells. That's the big reason why, particularly. Fibrosis is muscle mass is often replaced by dense, regular connective tissue. And it's to get decreased flexibility. That fibrosis is not really a good thing. Also referred to necrosis, whereby tissue becomes more like connective tissue over time too. There's also another way of referring to not just fibrosis. And lastly, anabolic steroids, from a standpoint of a clinical view, as performance-enhancing compounds. They're synthetic substances that mimic testosterone as it relates to basically our natural sex hormones and their responses. Cholesterol plays a great role with this. Taking in more cholesterol plays a role with testosterone, but taking anabolic steroids enhances this testosterone effect, and it can anyway. It requires prescription for legal use, stimulates the manufacture of muscle proteins, and it's a popular performance enhancer. However, side effects include increased risk of heart disease and stroke. It can happen. Kidney damage and liver tumors, testicular atrophy, loss of size, and breast development in males, getting more female or feminine characteristics. Acne, high blood pressure, aggressive behavior, or potential growth of facial hair and menstrual irregularities in women. And the fact is that steroids, what they're trying to do is reduce inflammation. The idea that your body in general producing natural steroids to help reduce inflammation. And that's what steroids do. They help reduce the inflammation from stress, consequently enabling you to train harder, train longer with less fatigue and less downtime. So consequently, you can get a huge, level above other people who are not using them. The downside is, however, one of the big downsides that's not mentioned here is that muscle tissue will grow faster than connective tissue. Connective tissue does not grow at the same rate and is not affected the same way. So that's why you often have people who use a lot of and abuse anabolic steroids have a lot of pulls and tears because of that. So section 10.8 then, what did you learn? What anatomic changes occur in skeletal muscle and when it undergoes hypertrophy, and what changes in skeletal muscle occur as a result of aging. And we'll cover our last brief section for this chapter shortly.